Did you know that there's a right and wrong way to floss, and that flossing incorrectly can damage your mouth? I've seen tens of thousands of smiles over my career, and I can almost always tell when someone is flossing incorrectly. The thing is, if they knew how to floss correctly, the difference would be night and day. Even though it seems fairly simple, knowing how to properly floss around your teeth can make a world of difference when it comes to preventing cavities, combating gum disease, and keeping your smile looking as young as possible. First, let's talk about why you need to know how to floss properly. The whole point of flossing is to clean the contact areas between your teeth, as well as under the edges of the gums in those spaces. Those contact spaces aren't straight. There are lots of curves, so if you're not flossing correctly, it won't clean off the plaque and may actually cut into and damage your gums. People who slide the floss straight down between their teeth can permanently cut their gums and change the shape of their gum line. Not to mention, they won't be removing the plaque that causes gum infections. It's almost as bad as not flossing at all. That being said, let's talk about the exact technique you need to use when you're flossing your teeth. The most important thing to remember is that you want to keep the floss taut against the side of each tooth. This will ensure that the floss is rubbing against the curves of the side of the tooth to lift away the plaque. Keeping the floss curved around each tooth will also let you safely slip the floss right under the edge of the gum line into the sulcus or pocket that's there. Now I know what you're thinking. You're not going to go too far down under your gums with the floss. If your gums are healthy, it will slip underneath the edge by a couple of millimeters. And if you have deep pockets because of periodontal disease, it won't reach all the way down inside of them anyway. For those situations, be sure to watch my video on water flossers. Since you want to have the floss in a C shape around the side of each tooth, you can hold it one of two ways. One way is to take about 18 to 20 inches of floss and tie the ends together, making a circle. Another way is to wrap either end of the floss around the middle finger on each hand. From there, you'll pinch the floss with your thumb and forefingers, giving yourself a couple of inches between. As you clean between each of your teeth, move the flossing string down to a clean piece. If it's wrapped around your fingers, simply unwrap once on one hand and wrap once on the other. Using a clean piece of floss helps limit the spread of bacteria from one area of your mouth to the other. This is a really important step in knowing how to floss, especially if you have a cavity somewhere or an area with an active periodontal infection. You want to floss around every single tooth, including teeth that aren't touching each other, like when there's a gap in your smile or behind the very last teeth in the back of your mouth, because those teeth get plaque under the gum lines too. If you have any type of fixed appliance or restoration, such as a bonded retainer, fixed dental bridge, a multi-tooth implant prosthesis, or something similar, you'll also need to incorporate what's called a floss threader. These are like flexible plastic needle-shaped oral hygiene aids that make it so that you can weave your string floss through those spaces. Remember, you need to be able to get down to the gum line areas and under the edges of the gums. So the flosser makes it where you can weave it underneath, wrap the floss, then gently pull it out through the side. Even though you'll want to throw the floss away, you can usually reuse the floss threaders a few times before disposing them. Speaking of pulling the floss out through the side, never force the floss up and out if it feels stuck on something. When floss gets stuck, it's usually because there's a leaky filling or cavity or something going on. Those rough spots can also shred or break your floss. Anytime you experience one of those scenarios, see your dentist ASAP before the issue blows up into something severe. Before we wrap things up, let's talk about bleeding. Chances are, if you haven't been flossing very often, your gums are probably going to bleed when you start flossing every day. The thing to remember is that you're not hurting yourself. Healthy gums don't bleed. Bleeding is a symptom of gum inflammation and infection caused by bacterial plaque in those contact areas under the gum lines. As you start to floss every day, the bacterial levels will go down as well as the inflammation. So within a matter of days, the bleeding should also improve. If you have gingivitis, the general rule is 10 to 14 days of daily flossing before your gums stop bleeding when you floss. If they continue to bleed, you more likely have a periodontal infection that needs to be treated by your dentist. Knowing how to floss correctly can literally save your teeth and help them last a lifetime. It's a simple step you can add into your day that will make a huge difference on both your oral and your systemic health. So remember, keep floss curved around your tooth. Floss daily. Use a floss threader if you need it, and pull the floss out through the side if it gets stuck on something. Make these changes and I can guarantee that your dentist will notice. I'm Dr. Joyce. Smile smarter, everyone. I'll see you next time.